New tonight, the National Institutes of Health will be funding studies to take a look at the long-term health ramifications of the train derailment in East Palestine. This is a big project with a hefty price tag. 19 Data journalist Jeff Slauson is here with the details on this study.
Now, I want you to remember, when the citizens of East Palestine accepted the buyout, there was a clause in there that didn't mean that they couldn't potentially sue them in the future if there were to be some findings related to health-related risks. It essentially was, we're going to give this to you as a in good faith amount, but there's still a chance these people could say, hey, we have health issues, and this study could go a long way for it. Now, Vice President J.D. Vance, formerly the senator from Ohio, very much so says that he's been very at the forefront of this to make sure this gets done. So it's going to be done over a span of 5 years, $10 million total to determine, like we said, those long-term health effects. Reminder, the 2023 train derailment in East Palestine, Norfolk Southern, released dangerous vinyl chloride into the community. A decision was made, a decision we now know did not have to be made, to burn off those chemicals, leaving that entire area smelling of chemicals, the ground making people feel unsafe, water contamination, things like that. So I mentioned there are three main things that are going to be covered in this study. Let's start with the first one. We're going to skip some of the large amount of jargon in the beginning of this, but essentially what they're going to be doing is understanding the health impacts of the exposure. Key here is short and long term, including relevant biological markers of risk. So that is step one, determining potentially the fallout of that vinyl chloride and other different forms of gases or solids that were put into the ground to see if they have any adverse effects on the people. Second, they're going to be tracking and surveilling all of the community's health conditions to support healthcare decisions and preventing measures. And then the last thing here, extensive, well-coordinated communications to establish a comprehensive approach to address those that are affected. So they're going to look at the potential effects, they're going to see how that has affected people, and then they will figure out how to take care of it. But the thing is, it's 5 years. So this is one of two ways, right? That's either enough time and we could potentially see the effects, or it's not enough. If someone had a young child in East Palestine, you won't necessarily know the effects until a far outreaching point. So there is a little bit of that. Now, that was acknowledged in the NIH's release. They basically said this is the enough time to at least get a baseline. They can always extend it if they need. But this idea starts at the beginning, determining what potential health effects could be, and then how to treat it from there. If anybody in East Palestine is actually interested in becoming part of this study, we have a link on our website at cleveland19.com. They are starting to take applications. The hope is to be able to actually begin this in just next month. So yeah, in July, to start gaining some knowledge about the potential effects of that derailment.
A 19 crime alert tonight in Westlake, and a Cheesecake Factory customer had her wallet stolen while sitting on the patio. Police spotting a man and woman acting suspicious on surveillance video. Well, they tracked that couple to a car and used license plate readers to follow them. Officers then, in orange, found them at Pinecrest Shopping Center. Investigators say video from local stores showed them using those stolen credit cards. James Clark and Deborah Williams.